Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CFAL York Operations Coordinator. I would like to officially open the fifth session of the Emergency Management in Hospitals and Healthcare Speaker Series, presented in partnership with the Thunder Bay Regional Health Sciences Center. I will begin today with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territories upon which our campuses are located that precede the establishment of York University. The area is known as Tkaronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and that the territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our panelists, and our participants from around the world. Welcome to our webinar. It is now my great pleasure to introduce our moderator today, Misha Richard. Misha Richard is the current Emergency Preparedness Lead for the Thunder Bay Regional Health Sciences Center in Thunder Bay, Ontario, Canada. In this role, she acts as a subject matter expert, assisting with the development and maintenance of emergency management governance, training materials, and exercises. Misha also volunteers as an editor for the Canadian Journal of Emergency Management and is happy to be a collaborator and facilitator for the CFAL York series. She holds a Master of Disaster Emergency Management degree from York University and bachelor's degrees from Western University and Brandon University in the focus areas of political science and disaster studies. Misha, thank you very much for moderating today's session and your ongoing support organizing this series. The floor is yours.
Excellent. Hello, everybody, and thank you for joining the webinar. Thank you for the lovely introduction as well, Francesco. I get to introduce our two speakers that we have today, so I'm very excited to have them both with us. I'll start with that, and then I'll do a little bit of housekeeping for those of you that don't know the format. So I'll start off by introducing Rick Caddick. So Rick has been in the fire service for over 25 years. He began his time in the fire service in a small rural volunteer fire department, later joining a larger volunteer department, and over 12 years moving through the ranks from firefighter to fire prevention, then to captain, and ending with the position of fire chief full-time. This grassroots training and working at every level has helped Rick immensely over the years. After a sudden life change event, he moved to another larger department and as full-time deputy chief, and ultimately became fire chief for 7 years. While ever striving to improve and learn, he was given the opportunity to apply for a deputy chief position of a much larger composite department. Rick currently assists in the management of 16 career and 130 volunteer department operating from 7 stations. This journey has afforded him the opportunity to learn and lead some amazing professionals and grow personally. He and his daughters are lifelong residents of the Quinte area. So now I get to also introduce Dave Pym. So Dave is the manager of Occupational Health, Safety, and Security for Quinte Health, a 4-hospital network in the Hastings and Prince Edward County region in Ontario. Dave's portfolio also includes emergency management and preparedness, and to this end has led a number of community exercises in coordination with emergency services and municipalities. During the pandemic, Dave was integral in setting up assessment centers with public health and was a part of the provincial-led team to return Canadian citizens from China in coordination with the Canadian Force Base Trenton. Dave is a graduate of Durham College, holds multiple instructor-level certificates in crisis management and fire safety and care and treatment occupancies. He also holds industry designations in emergency management, hazmat, and fire suppression. Dave is also professor of risk management for Loyalist College, a volunteer firefighter, and provides risk management consulting. Dave was awarded the top 10 under 40 for Canadian Security Magazine in 2023. So you can see you've got two fantastic speakers today. So again, for those of you that aren't familiar with how we like to run these sessions, the chat is open. We welcome you to populate all sorts of commentary and dialogue throughout the session today in there. But if you have questions that you would like directed specifically to either Dave or Rick, please put them in the Q&A and I will be monitoring that as best I can. Dave and Rick have informed me that they are comfortable to be interrupted with your questions. So we'll try and find some good pauses to bring those forward. And if not, we're certain there will be enough time to take up questions at the end of this presentation as well. So without further ado, Dave and Rick, I kick it over to you to get us started on your presentation today.
Okay, thank you very much, Misha, and welcome. It's indeed a pleasure for me to be here. I I'll be very honest. This is the first time I've done a podcast. Been on Zoom meetings many times, but really looking forward to chatting with everyone today about our project that Dave and I worked on last year. Dave and I have known each other for quite a few years, actually, and in the fire service. And I'm very proud to say Dave is one of our volunteer firefighters, and that makes it even better. And so again, welcome, and I look forward to chatting with all of you.
Yeah, thanks, Deputy. Yeah, so happy to join Misha in this. Something that I think Quinte Health and myself are quite passionate about is really developing partnerships with our local emergency services, local fire departments, local partners. And so today, really we wanted to talk about a couple of things. So hazmat in general, as it pertains to rural municipalities, but also an exercise that the deputy and I had an opportunity to spearhead last year that I think really helped us understand some of the limitations with hazmat response, but also some great opportunities for us to explore and work on. Misha, just because I can see you on my screen, you can see the slide deck okay? Perfect, great. So just a quick introduction for those who don't know. So the County of Hastings, where Rick and I are from, is kind of dead center in southeastern Ontario. So we're about halfway between Ottawa and Toronto. County of Hastings is the second largest county in Ontario with 14 partner municipalities, as well as we have Prince Edward County, which is just south of us. So Quinte Health Hospital is in this region, in our 4 hospitals, which I'll talk about in a second. Just quick note as well, there's a lot of vehicle traffic and everything else, and you'll hear the deputy talk about municipal high-rise, but we're kind of in a main corridor between Ottawa and Toronto, and certainly with the 401 and other traffic going through, we're quite busy. We're also rapidly expanding. So we have a population moving into the area, as well as just regular population growth going on. So certainly some exciting stuff in our community as we continue to grow. Quinte Health is a family of 4 hospitals in this region. So Belleville General, North Hastings, Prince Edward County Memorial, and Trent Memorial Hospital. Altogether, we have 2,600 staff and physicians and 335 inpatient beds. So we as a hospital in the last 10 years have expanded quite a bit. So certainly adding services on due to population growth and other clinics that we're offering. So really, it's kind of building this future path on these things because of such rapid expansion in our region, I think has been hot on the seams. And I'll turn it over to the deputy to introduce his fire department.
Thanks, Dave. And yeah, as I said, as was mentioned in my introduction, Quinte West Fire and Emergency Services. We are a composite fire department by all definition, in that we have both career and volunteer firefighters within our complement. We serve about 50,000 residents, but that does not include the large number of visitors that we have either passing through our area, because we sit right on the 401 corridor, which runs right through the middle of our municipality, and or the tourism and area. We're in a pretty heavy, well-known tourist region with those heading towards Prince Edward County. We have great fishing in the Bay of Quinte and all those sort of things. So we have a huge influx of people in and out of our municipality almost on a daily basis. Of course, Quinte West is notably home to Canada's largest military base, 8-Wing Trenton, which is a huge asset for us to have, and a great resource as well. We certainly value the partnership that we have with the base, and again, they draw a lot of people. And an example that we were in a meeting this morning talking about the air show that's going to be happening the end of June, which will bring in 50,000 people a day into our area. So that's pretty significant. As I mentioned, we are a composite department. We have 7 stations we operate out of. Our main headquarters in Trenton, is our composite station, where we have a full-time career firefighters on duty 24/7, and then our other 6 stations are all volunteer, 100% volunteer stations. And so that keeps us busy. 150 firefighters in total can keep me out of trouble on on a daily basis. But we have an amazing team, and that's why we are so fortunate. And the resources, not only in our team but in our equipment. We have over probably in the neighborhood of 38 to 40 pieces of apparatus within a city this size. That's pretty significant, but it's great, especially when you have a large incident. You have a lot to draw from. Also, as mentioned, David mentioned the mutual aid. I am the mutual aid coordinator for Hastings and Prince Edward County. So all of those resources of other departments we have available to us at a moment's notice, and that all is facilitated through myself. So we're and my co-coordinators in the different regions, and so we're very fortunate to have the resources we do at our fingertips.
So just dovetailing off of that, so just to take everybody back about a year and a half to almost 2 years ago, the deputy and I sat down kind of in this post-COVID environment and said, let's have a conversation about hazmat, and let's really talk about something that we haven't talked about in a while. This next slide is actually pulled directly from the debrief of the exercise we were able to put on. But as we started embarking on this journey, we started talking with partners, and unbelievably, all of these different partners had the same thought we did. Let's really kind of dove down and see and go through this. So we launched Quinte Synergy. It happened in October of 2023. As you can see, the hospital and obviously municipality of Quinte West participated, but also our local OPP, our Hastings Quinte Paramedic Services, Loyalist College, our local college, County Farm Center as the host of the actual exercise, as well as Pioneer Patient Transfer, who was a key partner as well. So all of these teams really came together on the design phase of this exercise because we all kind of had the same kind of vision on on this hazmat exercise. So like I said, we began in 2022. It started as just conversation between myself and the deputy. This ended up being the municipality of Quinte West 2023 municipal exercise. So they got to check that box as well as we were doing this. This was our third, as the hospital, major exercise involving external partners in the last 7 years. And I think we probably would have done more, but COVID certainly played a factor in limiting the amount of live exercises we could have. But I'm quite proud of that, because just being able to talk with your local partners, I think, is just a key part, especially when you're in a rural hospital setting. And like I said, County Farm Center, which is a private company out in the city of Quinte West, volunteered and was an enthusiastic partner for us. We kind of went into this with some goals, and I think that's important for any hospital kind of going down this path for exercises, really to establish goals. So I'll touch on mine, and then I'll turn it over to the deputy to talk about the scenario itself. But we really wanted to test our capability to handle a mass casualty event involving hazardous materials. So there's a lot of discussion right now in the province regarding Code Orange. Intermingling hazmat with your Code Orange is a challenging thing to manage, because suddenly you're having conversations about where do we put contaminated versus non-contaminated individuals. It's not just about putting individuals in a large group and mass triaging when you have this extra layer that you have to consider as well. So really a key thing for hospitals to talk about. Obviously, with COVID, emergency operations centers have changed. So using Microsoft Teams or Zoom or different online platforms, it's always a good idea to go back to the basics and bring everybody together in a room and sit down and put the vests on and do the EOC roles like we all in the emergency management field love to do. And then provide some in-service live training. And we wanted to talk with our staff and our management about what mass casualty events look like truly, how they actually develop, in particular in rural municipalities where the event could be half an hour away. And with limited resources to transport patients, this adds a dynamic of time that you wouldn't necessarily find in a city court. And I'll pass it over to Rick.
Thank you, Dave. Yeah, so in the city of Quinte West and namely Quinte West Fire as well, we looked at we had some goals and objectives that we wanted to see met. The fact that, as mentioned, we needed to hit that tick box for our provincial mandate that we must conduct an emergency exercise every year. It was a great opportunity. So we need to exercise our emergency plan. Does it actually work? And we found there was some challenges with that, and that's we'll talk about that further in some of the takeaways. We wanted to test our CCG, is the community control group notification. How do we tell people what's happening? How do we tell our group what's happening? How do we push that out to the public as well? And we want to operate using, of course, the new IMS system in the EOC. And of course, this again, it ensures compliance for annual emergency management requirements. From a Quinte West Fire perspective, we looked at this as a great opportunity because hazmat is not something we do on a regular basis. We dabble around the edge, but we don't get into a hard hard hazmat incident on a regular basis. So it was a great opportunity, and I know that the stations and members that were involved found it to be just that, that it was well worth their time. I'll be honest, we did some training with our crews prior to this incident, just to make sure that they were aware what does a hazmat incident really mean, and how does it get dealt with. So again, we felt very much. It was great. At the conclusion, we did complete a bit of an assessment and survey. And I don't think anyone come back, and Dave will correct me on this if I'm incorrect, but come back to said that was a waste of time. Everyone gained something out of it. Okay, so Dave, do you want me just to carry on with the scenario a bit?
Yeah,
or are you gonna...
yeah, if you don't mind.
It's up to you. So again, the scenario was basically that there was going to be an incident, and I think, Dave, in your next slide, you have a little more detail about that. Is that correct?
Yeah, a little bit farther
down. So basically, what was going to happen is we were going to respond to the County Farm Center for a vehicle fire and entrapment. That's how the call was presented to us through our dispatch service, and that. And another, just a sidebar on this, is I think we had just within 2 days prior to this incident, or to this thing, switched to an entirely new dispatch service that wasn't even and in fact we now are dispatched through St. Catharines Fire. So that was added into it, that now all of a sudden we had an entire new dispatch service that had to deal with this as well. So it was a great test for them as well. Anyway, we responded to the call, the initial call. We needed to, when we arrive on any scene, but specifically a scene like this, we have to look at assess the scene. We have to look at for number of patients. We have to decide what's our plan of attack, and how are we going to do this safely, and what pieces need to be put into place really quickly to make this happen. What's vital in these situations is the individuals that are there, the property owners, or in this case, the staff and management at County Farm, were able to provide us with a lot of information as to how many people were on site and where they may or may not be located, and these sort of things. So we had to liaise with them very early on, and this was part of their test to make sure that they were providing us with the accurate information. Once, of course, it was determined that there was dangerous chemicals present, we then, it's important then, of course, we have EMS, and we have police, OPP, responding with us, but that information needs to get back to the hospital, as David indicated. it's vitally important that they know what they're dealing with. And of course, once we get into any sort of an incident of this scope or size, it could impact our municipality overall. So we then notify our emergency management operations center, gets activated, and our control group convenes to basically provide support to the scene. That's their function. They're there to support the scene and make sure that all the other little pieces of things that we need, we can have at our fingertips, and there's good communication.
Thanks, Steph. And just so people have some context on what this building looks like, and you're going to hear me talk about this a little bit later in the presentation, but sometimes it's difficult for a hospital when we're doing our hazard and risk assessment to really understand what in the community is hazardous, and some things are obvious. And I see some great conversation in the chat about the nuclear plants, and you know, those types of things require very specific responses from partners. But this was a good example of, you know, driving down the road. Somebody like me or somebody else working in a hospital would likely not assume that something like a farm center would have as many chemicals and as much danger potentially as we run into. So this plant in particular, the crop production warehouse on the top left of your screen is where we were talking about. You're going to see some pictures about the inside of that, but also note, you know, there's a huge propane tank in the back, and so certainly, you know, lots of things going on here. Now, I will say that County Farms, and the deputy may correct me, but I doubt it, has a very robust planning and safety protocol as well. So we were almost challenged with trying to figure out a scenario in this particular case of what could go wrong, because, you know, they have a lot of contingencies in place, and these industry partners do a lot of work on this, so it's great to have those conversations. This is the inside of the building. Now, this is after we had asked them to, you know, simulate what an explosion would look like, because usually this storeroom is extremely well kept and everything is good. But we had them set up, you know, what post-explosion could something look like in here, and let's scatter some stuff around and kind of make things a little bit more realistic for our firefighters. So just in terms of the incident sequence, so we had finally landed on 2 county farm staff working in the warehouse. There's an explosion. 2 other individuals who are working in the warehouse become involved in that explosion, and we don't know where the driver's whereabouts are. So working with our emerge department, I kind of created these injuries per se that the fire department would run into. And I'll pass it over to the deputy to talk a little bit if he wants to add in. But these types of patient profiles for emergency services are quite challenging to deal with, and there's a number of things in here concerning oxygen or explosion injuries. But the big part here is just labeling our patients as decon patients as well. So that adds a layer into the response. For example, you can't just splint somebody's arm when they're covered in a chemical. You have to actually take steps to decon them before you can interact with that person. Deputy, I didn't know if you had anything to add on this one, or.
No, Dave, I think again you covered it well, but yeah, it's so important. And again, when we pull up to a situation like this, we have no idea what we're walking into until we get there, and then we have to quickly formulate some sort of a plan as to how we're going to, you know, conduct a primary search and make sure that we locate as many as possible. You know, there's walking wounded, there's people that maybe we can walk out of there, but a lot of them may have to be brought out in some other format. So again, it was this challenged our crews, and that's what we want. You needed to have some challenge, and Dave and his team in the ER did a great job, I think, putting these patient profiles together.
So we had the initial incidents. So the county farm staff had their own specific fire response, which they have a muster point. They go to meet the fire department. So the fire department arrived on scene, and this is actually what occurred. And then they had a bit of a conversation with county farms to kind of get some scope on what they were dealing with and how that was unfolding. This was the second update for individuals. So continuing on that theme of your most critical down to your somewhat least critical. We really did a lot of work as well, just talking about order of evacuation and those types of things, and how we can prioritize people on scene to start doing treatment on scene versus who needs to go to the hospital right away. You're going to hear us, the deputy and I, talking about this unified command thing, because the fire department will extricate people from scenes and then turned over to paramedics, and the paramedics will prioritize people based on symptoms. So we actually included from the get-go a CTAS level for paramedics to just kind of help them wrap their brains around, what are we dealing with and how are we navigating this. Just moving quickly through again, the team got set up. They started to do their continued search, and then of course we always add this in, because it does happen. First responders get injured too. So firefighter trying to be a hero hurts their back and strains it. So we added them into the mix as well, because that does create its own issues and problems for the scene. So this is kind of what our final map looked like, with 10 total patients, and highlighted on CTAS level and order of evacuation. So really kind of setting the stage for how this was going to go. Now, very quickly, we had actually individuals playing these parts. So we had Loyalist students mocked up as victims. We had Loyalist College supplied a number of their firefighter students from their firefighter program, as well as paramedic students. So we actually had real individuals for people to interact with, which I think really added to this exercise, and is a really key component. It's fine to mock individuals up, but to actually see somebody and physically interact with them and have them bandaged up or injured is really a key component of these exercises. We actually received patients. So this is an overhead map. So although this incident happened in Quinte West, just the way that paramedics respond, they came to Belleville, our main hospital, which was great because we were able to actually mock up an ED. And so we made a quote unquote emergency department based on that. And so we were able to actually have those patients get received and do that as we were going through.
So I have a couple of quick questions.
Yeah, of course.
One came through the Q&A. So I was waiting because I knew you were going to talk about how they were coming to your actual mocked ED location. But there was a question in the chat wondering if, and I'm not familiar with this particular facility, but if the Ross Tilley Burn Center was involved?
No, I don't actually know who that is either. I know, just in speaking with burn patients, what would usually happen for us is we would either receive them at BGH and then ship individuals out after that fact through Orange, or perhaps they may even go direct from scene. So we try to keep it as local as possible. Obviously, there's a lot of players in the province for that would receive people, including even in our own exercise. So we had one individual with a broken femur. We have a protocol that they go direct to Kingston Hospital, which is our trauma center in the region. So we did try and keep this a little bit more local, and we made some allowances to just have the staff go through. But certainly we do ship people to burn centers quite frequently, well, not frequently, but when they happen. But we didn't involve that. On the second question, through planning exercise, how long did this take? So that's going to be a little bit later in the presentation. I'll talk about that. All hospitals involved stood up mock incident command. Yeah, we did do that. And yes, and so I'll cover those as we kind of go through.
Well, I'll jump in with more. So actually, first off, we did have somebody clarify in the chat that particular burn center is at Sunnybrook. So thank you. I was going to say we're not always familiar for recognizing that we do have an international audience of attendees where some of these places are, or the specifics of the specific centers. But I did see one question got populated in the chat. So this is, again, another reminder to any of our participants that are joining. If you have questions specific to Dave and Rick, please put them in the Q&A. It's a bit easier for us to monitor. But there is one that was put into the chat that was asking about the protocol regarding transport, and if you have an understanding where transport or not to transport until the decon has been performed. So I know that question comes up frequently when I end up talking, pardon me, about hazmat, and I knew it was going to come up here as well. So
I'll turn that one over to Deputy Caddick, because I think he's probably got a pretty good guidance on that.
Yeah, Dave. So yeah, in answer to that question, of course, patients need to be decontaminated before they are put into the EMS unit. And did we actually do that in this scenario? No, it was end of October. Getting sprayed with a fire hose at the 25th of October might have been a little chilly and uncomfortable, but we certainly did simulate it, and they were identified as either, that they had been decontaminated. And when we set up a scene, especially a hazmat scene, we have to set it up in zones, right? So you have your hot zone, your red zone is where everything is, that's the incident, that's where it's happening. You have your warm zone, which is your, cooling area, which is where you would decontaminate people. There's still a level of contaminant, but not to the same level as in the hot zone. And then you have your cool zone, which is where, okay, people are decontaminated, they can go in there, and that's where EMS intervenes at that point. Because, and that's something that we identified, that maybe we didn't set those zones up far enough, or, there was more of a logistical piece. But yes, to answer the question, patients must be decontaminated. Otherwise, if they're not decontaminated, you've now just pulled an ambulance right out of service, because it cannot go back out again until it's decontaminated. So and I know EMS is very mindful of that. And, we even on our regular course of business, we've had to decontaminate people, both even just potentially because there's a problem, before we actually transport them by ambulance.
I think that's a great reminder, Rick. I appreciate you clarifying that, and especially since the session is recorded for that reminder. Sorry, so back over to you, Dave and Rick, and we'll see what other questions come through as we go along.
So to answer the initial question, so we, as Rick said, we did actually transport people using EMS, and we had some simulated ambulances as well. But we kept the number of rigs down, because especially in rural municipalities, you don't get 15 ambulances showing up at a scene. So you have a limited number. So as the deputy pointed out, to pull an ambulance out of service because it's now contaminated is a big problem, is in particular if your scene is 30 minutes away and you have to allow for that travel time to and from the scene as well. Deputy, I'll just turn it back, just cognizant of time, but just on a very quick level, what actually did we go through in terms of steps?
Okay, so basically the as indicated there, the two stations, the vehicle from two separate halls responded. As always, we conduct that initial assessment. What have we got? We do what we call a 360, look at the entire situation, get our information, and begin to develop an action plan. Collaborating with our partners is vital at this stage, because we may need that. We need them, but it's going to take them time to get there, if in fact they haven't already been dispatched. We're very fortunate within our system that in something like this, it's automatic. EMS is coming, police are coming. It's automatically handled through our dispatch center. We don't have to ask; they're already on their way. So that's good. Again, we conducted a primary search of the facility once we had an idea of where people may be, and then begin to develop plans as to how we're going to extricate these folks. Again, our training officer, who also happens to be the Loyalist College coordinator, we were able to bring pre-service fire students alongside our members, and they worked with them. It was a great learning opportunity for the members and for the students, and it gave them an opportunity to deal face to face with some of the actual players And that wasn't just in fire, that was in the EMS as well, as David mentioned, through the paramedic program. That was through police with Police Foundation. These folks were actually in the vehicles with those people responding. There's quite a few others that were involved there as well, and I know Dave will cover that further on.
Yeah, and just to kind of talk about the overall response part. So County Farms did actually participate in the drill. They did assemble in their assembly area. They did speak to the fire department when they arrived. Just a quick note for anybody planning an exercise like this, if you're using a private partner, you do have to make some assumptions that there will be business as usual going on. So we were kind of on the one side of the complex doing this exercise, but on the other side, they were very much running back and forth and doing their thing. So a number of the participants did go back to work once the initial stuff was done, which adds a complexity to scene safety, which I think is a really key point for any hospital to consider, or any municipal partner that might be on to consider. Is really, really valuable to have a scene safety officer for the exercise specifically, just to kind of deal with that dynamic, because it can cause some confusion. We did have Quinte West OPP actually respond. They were there with cruisers. They were there observing, doing some traffic control. We had one of the members on the planning group, and certainly, went through the motions of doing those public communications and those evacuation type orders. Like I said, we had Hastings Quinte Paramedic Services respond. I did see a note in the chat asking about Pioneer. If Pioneer's in our MOU, they are not. We would always defer to our paramedic services, and if they require more units, they have their own mutual aid, and will connect with neighboring services to help support. But again, resources are limited. But and you're going to see Deputy Chief Mike Slater in the next slide, but he was very instrumental in having paramedics come out and do some training and do the on-scene stuff. So we certainly had that. And like I said before, a big shout out to Loyalist College. Not only did they supply students, but as you're going to see in the next slide, they also supplied our media scrum room and our debrief hot wash area as well. So that was pretty integral, but they were there as well, which was great. We actually did a media scrum, which we live streamed out to the EOCs. So you can see Deputy Chief Mike Slater on the left, Sergeant Jeremy Doolin, our own communications consultant, Nicole from Quinte Health, Chief John Whalen from Quinte West Fire, and Quinte West Mayor Jim Harrison as well participated. So we did this whole media scrum. We asked some questions. The deputy and I pre-populated some of those questions, but we did leave it fairly open. So really important part of an exercise is to do that communication and actually go through the motions, and that was well worth it. And again, as you can see, this was set up right in Loyalist College. They actually set up the media center, and that's us kind of all hanging out in the background, because as the exercise ended, this was our meeting point for the hot wash. So we made it kind of look like a busy operations center, which was great. Just to give you a scope on the timing of the exercise, so we started, the deputy and I started at about 6, but the rest of us started at 7. We did evaluator meetings at Loyalist College itself, so all the responders kind of gathered there. We went to the site, did the final prep. We started the exercise at 10 o'clock, so you can see that's 3 hours from us talking about the exercise, the go, no go, are we actually going to go ahead, weather's working out, everybody's here, and there was some hiccups that you always have to account for in these exercises. And I think, I probably gained a couple of gray hairs just thinking about all the different scenarios. Is this bus going to show up? Is this service going to be available? Because the other key takeaway for hospitals, if you're working with your emergency services, is you have to build a contingency in case they get called away to an actual emergency and aren't able to respond. So we had some things set up for that. We had a control group scrum at 11, and we wanted to make sure that we were hitting key points. We actually wanted to do some pushes. We did a actual media conference right on the site to talk about the collaboration. That was good. And we did another quick scrum, and this is actually a picture of that scrum happening right on the scene. You can see members of Loyalist College, myself, the deputy, the fire training officer, just to make sure that we were getting what we needed out of that scene, and participants were enjoying. We completed the exercise at about 1 o'clock. And then we had a lunch and a debrief at Loyalist College. And we actually filled this conference center room and brought everybody in and talked about all the way from the paramedic services to the fire services to the hospital. Members of my team are in this picture as well. Just bring everybody in and go through that hot wash as it's happening. So that's really a key component. Moving over just overall from the exercise. So the hospital took away a couple things. So one, work with partners on unified command. So trying as a hospital to get involved in the actual unified command of the response is critical, because we really need to find out what chemical is involved and get that back to the emergency department. We need to understand how many victims are we actually dealing with, and what is their status, and what things can we prep for? Do we need to start prepping for transport, for burn, for example? Are there other things to consider? The more notice that we can get about fractures and those types of things, the better. Knowledge is always power in these things, and getting it from that front. So establishing that liaison officer early, having that partnership to have a liaison officer is really critical. Ensure fulsome nursing participation in exercise is a key component. This was a bit of a miss for us. So we did have some nurses working in our mock ED, but one of the things we got back, it was really great to have a full ED staff complement. We're limited, unfortunately, as most hospitals are, with staffing and that type of thing. But again, always a great opportunity when you can to do that. IMS training for staff is always great. We've got some really strong managers and directors in the hospital. They're very good at IMS. I always a big advocate when you're doing training exercises, let somebody who's never done it before take the lead and have those conversations, because you never know when people are in the Bahamas or out on vacation and those key players. So it's always great to have somebody that normally wouldn't fill a role, fill a role. And then we really, this underlines something we already knew, but talking about CBRNE status in Hastings County and what that looks like. And on my end, and I'll talk about this on the end for lessons learned, but understanding the difference between the actual CBRNE tent that came out and that kit that came out to hospitals way back when, for those of us who've been around long enough to remember, versus a decontamination room, which we actually do have at Belleville General in our new Picton Hospital, which I'm wearing the shirt for, by the way, back to build, versus an agreement with external partners. And I have some colleagues out in the province that have great agreements with external partners. So just understanding what fits your needs. And for us, this was a big conversation to have. So I think that's really important to highlight. Deputy had some lessons as well.
Yeah. And yeah, so again, and going back to Dave's point of unified command was something that we found and was brought out of this as saying, like, because you have the fire command, OPP command, DMS command, you have all these individuals, and if they stay separate, they aren't sharing as much as they could. So we quickly and we really understood clearly that unified command is vital in these type of things. So we need to make sure that happens in a real event, and of course when we do exercises. Again, I talked about decontamination and the different zones that we have to set up. Is there a defined route for people to go to get there? Because again, you're needing to make sure that we're keeping folks that are contaminated away from those that aren't, especially when it is a dangerous chemical. And we want to make sure we're not cross-contaminating people by the virtue of the fact we're moving them. So these are, some possible using pylons to map walkways, that sort of thing. New department-wide accountability system, and that's something we identified really come through really loud and clear. And so we have already begun that process and have started a new accountability system within our department that is department-wide, not just per station. And so these are some of the great takeaways that we learned from this exercise.
And then I brought this up just to kind of as the final talking point to our hospital partners on the line, because I think this is, to me, this is something I'm quite passionate about. And this is this dynamic shift for rural hospitals, I think that has to occur when we're talking about that CBRNE program. So really critical to understand what your local response looks like. And for us, we're so fortunate to have, great fire services, paramedic services, and policing services. So, we get to have those conversations, but bridging that gap, I think, is really important. And you don't have to be a hazmat expert. You don't have to be a hazmat expert to understand what it looks like. But I think asking those questions to the experts, I think, is really critical. So some areas like county farms have containment type of things set up, but really understanding, where are the holes and where are the risks. The fire service and the local municipality are great resources for this, because there's various legislation that requires people to advise municipalities and fire departments about hazardous materials. So they're a great starting point if you don't necessarily know where to go with that. I'd always highly recommend, in particular with rural hospitals, connect with your local community emergency management coordinator for your municipality. Get involved in those meetings, get involved with the fire departments and paramedic services and the policing services, and really be a selfless advocate to yourself and your hospital. I think the deputy has probably learned over the years, I am everywhere. I try and be as integrated in to the point of being annoying with these services as I can. But I think that is a critical way that hospitals can get involved and be part of that overall response. Liaison officers are one of the most critical aspects of a response for hazmat. Having somebody that understands emergency response out in the community and what that looks like, and really to be the voice of those people in the hospital, will save people a lot of time and effort, and certainly this concept of working in a silo at a hospital to prepare for things. Get the information from the emergency services right away, because you could be receiving patients from an incident that's happening an hour away, and having a fulsome look at what that looks like. I think the key takeaway here is, we had 10 patients with 4 ambulances, and we did not actually fully receive all 10 of those patients after the full exercise. So in a 3-hour time period, all of those individuals did not end up at the hospital. So with rural hospitals specifically, you don't necessarily get this influx of 50 people showing up at the door. They will filter in over time, but with limited resources, you do have to start making some contingencies early on. So the more resources, the better. For your CBRNE program, looking at staffing, I think, is a critical component. So I have 2 hospitals that don't actually have enough staff in the building to open and use those CBRNE tents. So that is a period of reflection that we have to make as a rural hospital. How are you going to run your CBRNE tent out in the parking lot at 3 o'clock in the morning if you only have 5 staff members working in your hospital? Understanding that you also need to run an emergency department, and you also need to run a radiology department. So you can't commit your entire staff to setting up your tent and then not receive anybody because they've been deconned at the scene. So I think that is certainly something that has to get reviewed. Accreditation is the big bucket word for hospitals in the province. We all want to make sure that we're hitting those accreditation standards. I just went through an accreditation this past fall. A lot of language about key partnerships with local groups, exercises, really important takeaways. Interestingly, CBRNE is not mentioned in the new accreditation standard. It is actually only referenced that you have a plan within your community to deal with those types of events. So that can include, joint responses with your local services. But I would strongly recommend that, that's documented. You have those meetings, you've had those conversations, and that's what the accreditors are looking for, which I think is a good thing to review. Health and safety of your staff is paramount. So one thing that we really have to drive home is, if somebody shows up at the hospital and they haven't been decontaminated, what steps are you going to take to make sure that you don't compromise your emergency department, your physician that may be on, your nursing staff? Again, smaller hospitals, you only have so many physicians and nurses in the building. You have to protect those resources. So there are discussions in particular where somebody stays outside until they've been deconned, so you don't compromise your emergency department. And this is part of that risk versus reward conversation. So really just making sure that you're having those conversations. Lots of opportunities in new builds if you're building a new emergency department or having to think about hazmat in that way. So a lot of hazmat cases in rural is 1 or 2 patients. It's not 50. So setting up, a hazmat specific room and integrating that in as part of your design is good. There's a lot of best practice out there in terms of, keeping the entrance separate, having a specific staging area for that to happen if somebody comes in. So just getting involved and looking at those designs from an emergency management perspective, I think, are pretty key. I'll pass it back over to the deputy for a final word on the presentation, and then we'll close her out.
Thanks, Dave. Yeah, to Dave's point about earlier in the slide previous that you don't have to be an expert. I'll tell you right now, we're not experts, but we have the ability to gain information on a very rapid basis. We employ the use of Caddick. Caddick is a company that, it's a provincial entity, I believe. Could be federal, but I think it's a provincial entity out of Ottawa that actually we can contact 24/7. They have operators standing by. These are not just a regular operator. These are actually scientists that actually will tell us. All we do is give them a chemical name, a number, and they will give us all the data we need to know. How do we fight a fire with it? What is the area of evacuation that needs to be? All the data we need to know about that. And so these are our external resources that we use, and we use them on a regular basis because when we're dealing with any sort of chemical, just to be sure we're, how is it going to affect our personal protective equipment, our bunker gear? How is it going to, because some of that gear, those chemicals will have a negative impact on our gear, and then thus our staff is not being protected properly. So again, there's resources there. Please always make sure you take advantage of those. And to Dave's point, it's so important to liaise with your partners, your community partners. Make those relationships happen long before that 2:30 in the morning call when things start going sideways and you're going, okay, now who do I talk to? It's nice to have a familiar name or maybe have had a discussion previous. I did note there was a question in the Q&A about what is an accountability system, and I'm sorry, I'm used to talking to fire people and they kind of know, but so an accountability system in the fire service is basically when our staff or when our firefighters arrive on scene, there's a couple of things that need to happen. Number one, they need to check in. So we have to know who is actually there. Where are, and that's done usually through a tag system that we use. So you basically tag in that you're on scene. And then when you enter the hot zone, you have to tag in there. So there is an entry control officer who their job is to tell us, okay, I know we have 6 firefighters in that location. And when they come out, they tag out, because that way we don't lose someone in there and not know, especially in a larger scene, when you'll have multiple crews working in an area, you need to know, okay, this group of 4 is together, and when they all come out, they come out together. You go in as a group, you come out as a group. And so that's what an accountability system is. And we certainly, it's vitally important. And trust me, the Ministry of Labor would be very unhappy if we don't have a good accountability system. But that's about it, Dave, for me. Thank you.
So I think Dave and Rick, you've really covered a lot of things, and there's certainly a lot of envy, I would say, that is probably felt by participants about how robust your relationships are, not just between yourselves, but amongst a number of your community partners. I know there was a question in the chat that Dave had read early on and then was saying, we're going to kind of get to that a little bit later because it was a bit of the 3-parter. So really, when folks are hearing you talk about this entire project, so the planning, the exercise, the after action and debrief, that question of how long did it take, I think you had clarified this took, basically a year of planning and execution. And we're not the first folks to hear kind of your lessons learned, your takeaways. So clearly you've wrapped up that part of it as well. And additionally noting that, everybody, all the hospitals that were involved had their incident command stood up, and I think you had clarified that as well. But one of the questions was, do you have plans to repeat this exercise in the future? What's your upcoming exercise plans, gentlemen?
So I am in early talks with another municipality about doing a mass casualty exercise involving quite a few. I would say Loyalist College is very interested in participating. So I have kind of an emergency management roadmap for the hospital, and that's to do a live exercise at least every 2 years. Understanding that these take some time, but we likely won't do another hazmat specific one, but we are going to do a mass casualty one. The hope is to involve more broadly different hospitals in outside the region, as well as multiple paramedic services. So, but really kind of putting that in the middle of nowhere. So having your volunteer fire respond to it, paramedics respond to it, and go through those motions. I know that the DEP as the emergency services liaison, I've hinted to him that we're going to look at it, and I think he blindly accepted without maybe knowing the extent. But sometimes it's good to have surprises.
Oh, sorry.
Yes, we're always working on it.
Yeah, indeed. That's certainly the true, Dave. And yeah, again, any type of incident or any type of exercise like this, it just brings the whole. It's training. At its grassroots, it's training. We're training our staff and our firefighters to respond in a way that it is not something we do. We don't put out fires every day now. We don't. That's not the fire service. That used to be the basis of our business. Yes, we still do put out fires, and yes, we have to train to put out, but we do more medical response than we do fires, and that's the reality of our area. But again, so it's really important that we get involved in any of these type of exercises, because it just creates there's so many positives that come out of it. You would be foolish not to.
There was a note in the chat, sorry, because I know every emergency management hospital person is probably wondering about costs. So how much did the exercise cost? So participants shoulder the cost of their own individuals participating. In terms of overall cost, the deputy and I bought everybody lunch, and that was about it. So thankfully, when you involve partners, they certainly can supply the staffing and everything else, but a lot of it came from generosity of partners. So Loyalist College gave us the space for free, in exchange for the amount of participation that they got. So certainly going into the conversation with here's how this exercise is going to benefit you. What can you do to benefit back for the exercise? I think is really critical.
I think the one piece ends up being, again, that potentially jealous feeling that we all have as far as the amount of staff hours, though internally being committed to this. So certainly there's been great efforts to cultivate the amount of internal buy-in within your organizations to have that staffing set aside to support these. And I won't say to anybody on the call that that's easy. I'm sure that takes, it's ongoing. But each time that you're able to provide follow-up like what you're doing right now, to give these presentations, to explain how you're going to apply these lessons learned, what those next steps are, just continues to foster additional buy-in and hopefully more interest from folks to participate the next time an opportunity like this comes around. I have to be respectful of time because we have hit our 1 hour mark. For anybody that has additional questions that we weren't able to address, because as we noted, a few of those came through the chat, but also you might think of things subsequently, is Francesco has dropped his email into the chat so that you can reach out to him via CFAL York, and we can pass your questions along to Dave and Rick. But really now I'll just take a quick second and thank you both, not just for the efforts to enhance emergency preparedness within your organizations and your community as a whole, but taking the time out of your busy schedules to come and speak to our audience about what you've been working on and the takeaways that all of us can sit with. And additionally, the reminder that the sessions are recorded. So for those that weren't able to hear it today, your lesson still stands in the future for them to be able to go back and refer to. So thank you again very much, Dave and Rick, for being our speakers today. I'll turn it over to Francesco.
Thank you so much. Yeah, just to quickly echo my thanks. Yeah, thank you so much, Dave and Rick. That presentation was great. I hope, I'm sure everybody learned a lot from that. It was great to see the planning and everything that went into the work that you did there. And thank you, of course, Misha, for helping put this panel and or this session and all of the sessions in this series together, and for moderating. And of course, thank you to everyone in the audience for taking the time to be here, participating, asking questions. It's always great to see so many people connected and engaging with the content. And just as a reminder, this is a monthly speaker series. We are still continuing the speaker series and are working to put together the next few sessions. So if you would like to keep attending or keep getting updated with these sessions, just please follow us on our social medias. I posted it earlier, but I'm putting it in the chat again right now. All the updates for the sessions coming up will be on our social media, and you can also see it if you refer to the event page. Every once in a while, we'll update it as sessions are planned and confirmed. So with that, but they'll always be on the first Wednesday of the month. So yeah, just mark that down on your calendars and just keep checking back. We'll be posting updates as we get them or as we finalize sessions. So yeah, just one last big thank you to everybody. Great session today. And yeah, thank you so much for everyone taking the time to be here.
Thank you.
Thank you very much.